Everybody, thank you for joining us for our first CFSS Provider Agency office hours. We're happy that you're here today and hopefully can give you a good overview of CFSS and answer some questions if you do have some. So my name is Erin Haldine. I am the CFSS policy consultant here in the Disability Services Division, and I'm joined by my supervisor and the supervisor of the home care and self-directed team, Janine Wilson. So she may unmute herself and speak as well as we're going through today's presentation. Let me see. Oh, I apologize. Bear with me. I seem to have lost access to my screen. There we go. Okay, I've got it back now. I apologize. Okay, so some of this information, if you already feel like you know a lot about CFSS, or maybe if you've taken some of the trainings or attended other meetings that we've held, some of this information might be review for you. We really created today's presentation for somebody who is brand new to CFSS, and so we weren't sure exactly where everyone would be starting at with attending today's meeting, and so this is kind of basic information, but we're going to start by going over the CFSS overview or the process authorization. We're going to talk through some different resources and trainings that are available to you, and then any future meeting dates that we have. So the first thing I want to start with is, what does the CFSS authorization process look like from the time that a person gets assessed to the time that the lead agency enters in the service authorization? And we'll click on this authorization process link here. In here, we have an automated version of what we're going to be looking at with audio. I'm not going to click on that today. Instead, I'm going to click on the one that has no audio, and we'll just talk through it. And the first piece that happens is the lead agency completes an assessment. So here we are, the assessment. The county or tribal nation will meet with an individual and conduct an assessment and determine if they are eligible for CFSS. There are some lead agency assessors who are using a particular form called the 6893A, and they're going to upload that into Min Choices. That is really not super apparent information for you guys, but we do have this on the screen. This link here that we're going through today was really designed for both lead agencies and providers. And so there are pieces of this that are going to be important for you to understand, but some pieces that are really just important for lead agencies. So that one in particular, they're going to upload the information into Min Choices. They are going to send the person or their representative the eligibility information regarding CFSS. And they're going to share a list of consultation service providers with the individual. Okay. The next step in the process is for the person or their representative receives the information regarding their eligibility, how to select a consultation services provider, and then they're going to inform the county or tribal nation of their selection. So which consultation services provider did they choose? Okay, and the person, they're going to be receiving that list from the lead agency. They can call or email or somehow contact the different consultation services providers and find one that best fits their needs or is available to meet with the individual. Then the county or tribal nation will work with the individual to create a Min Choices support plan. Then the county or tribal nation is going to authorize consultation services for the individual. So that is the first line that they're going to enter in the person service agreement, because at this point, the person has not chosen a PCA or a CFSS agency provider. And so they're going to authorize a line for consultation services. If the person is currently receiving PCA or the consumer support grant, the lead agency is going to authorize an additional 6 months of PCA or CSG. So I apologize, on the screen, we still have 3 months. That was the timeline when we created this, this process, but it is now changed to 6. And we'll review that in the 6-month authorization in a few different slides. But The person is going, or the lead agency is going to authorize 6 months of PCA or CSG if that is the service the person is currently using. And then they're going to alert the consultation services provider that they can begin working with the individual. So next, the consultation services provider is going to receive a service agreement, and then they're going to access the person's assessment results in MinChoices. Next, the consultation services provider is going to meet with the individual, and they're going to educate the person or their representative about CFSS and assist them in writing with their service delivery plan if they choose to do so. And then the person is going to work on developing their service delivery plan. So the key piece is that the person or their representative is responsible for writing the plan, and they can have the assistance of the consultation services provider, but they don't have to use the consultation services provider to write the plan. The consultation service provider always has to review the service delivery plan if the person chose to write it on their own. Or, of course, they can get the assistance of the consultation services provider to help develop that plan. Then the consultation services provider will upload the service delivery plan into MinChoices for the lead agency to access. And then they'll alert the lead agency that that upload has occurred. Next, the county or tribal nation is going to go into MinChoices to review the plan, and they'll either approve or deny the service delivery plan as written. If they deny the service delivery plan, then they'll issue a notice of action to the person. Next, the county or tribal nation is going to send a copy of the service delivery plan to the person and the providers that the person has chosen. And then lastly, they are going to enter a service agreement into MMIS. Okay. So I'm going to pause there to see if there are questions in the chat regarding this particular process. If it's regarding other topics, we'll probably save those to the end. But anything in the chat regarding this particular process that we should review? Oh, I do see one in here regarding the 6-month authorization. So I'll actually review that in a couple of slides. Okay, so this is just some helpful forms and documents that we've published for CFSS that you might find helpful to look at. So I'll go ahead and show you what that looks like here. So this is in our CFSS policy manual. If you're not familiar, actually, let me just click on this link. The CFSS policy manual here has a whole bunch of information. If you're not familiar, you have not yet looked at the CFSS policy manual, please do so. It's a great resource for individuals. It has a lot of different links and pages, particular regarding provider agencies that you would want to review, policies and procedures, training, supervision and evaluation, controlled housing, marketing, wages, and benefits. Okay. But one of the other pieces that we wanted to show you is underneath these resources section here, we have forms. Okay. And within here are all of the forms related to CFSS that we've published. And so we recommend that you review the forms that have been published, and so you know what applies to you as a CFSS provider agency. So there are some published here that are for lead agencies, some for FMS providers, as well as consultation services providers. Okay. So you can go through these. Okay. Hopefully you have all been invited to the CFSS provider agency enrollment office hours. They are held every Thursday from 11 a.m. to 12 p.m. They just started, I believe, 2 weeks ago. They started these meetings, and that's really a meeting for our provider enrollment team to connect with you regarding CFSS enrollment and the transition to CFSS. where our office hours that we're holding here are regarding CFSS policy. So we wanted to make sure that we distinguish the difference between what those office hours are. We apologize, there's a little bit of confusion that we name them somewhat similar names. And so know that if you're attending the meetings on Thursdays, that is regarding CFSS enrollment. If you have enrollment questions, if you're currently a PCA provider and you haven't yet been coded or enrolled to provide CFSS, make sure that you are attending those meetings or reviewing that process at those Thursday meetings. And then you can just click on a link that should have already dropped into your minutes inbox to join those meetings. You do not have to pre-register for those Thursday meetings. Okay. If a person has chosen you as their CFSS provider, and either you haven't submitted all your enrollment documents to be enrolled, or you're not yet coded for CFSS, maybe we are getting a lot of enrollment paperwork, and so maybe we just haven't gotten to your paperwork, or some of the information is missing or filled out incorrectly. We're asking that you contact the MHCP Provider Resource Center at this number, 651-431-2700, in order to finish that enrollment. Okay, so you can attend the office hours on Thursdays, or you can contact this Provider Resource Center if you've already submitted your documents and you have someone that's chosen you and ready to start, and you're unable to start with that person because your enrollment isn't yet complete. Okay. So one of the next things that we wanted to talk about, and this is something you're probably all familiar with, is so CFSS started on October 1st. Because there were issues with provider enrollment, as well as people being able to get in with consultation services providers. We originally had approved or given guidance for lead agencies to extend the current PCA service agreements for 3 months. And since that time, we've actually extended that to 6 months of PCA services. So if someone was receiving PCA prior to the start of CFSS, they'll continue to receive an additional 6 months of PCA while they meet with a consultation services provider to develop a plan, and while DHS is working to enroll all the different providers. Okay. Now, if a person is ready to go before that 6-month time period, and they have an approved service delivery plan, and they've chosen a provider that is already enrolled, they can start prior to that 6-month period. Okay. So they do need to stay on 3 months of PCA, but if any time between the 3-month extension and the 6-month extension, the person has developed their plan and their provider is ready to go, the lead agency can end that 6-month service agreement early and issue a service agreement for CFSS to begin. Okay, I'm going to pause there for a minute to just kind of let that sink in. DHS is also in the process of extending all of those service agreements. And so likely you had received 3-month service agreements for some individuals. And we are currently working on the service agreements that end at the end of February. We're working to extend those an additional 3 months. Okay, so we're just going in date order. So currently we're working on the February authorizations, extending those to a six-month time frame. And then once those are done, we'll start working on the March service agreements. So if you haven't received one yet, and that person ended at the end of January for some reason, please contact us and let us know. Otherwise, we're working on the February authorizations and you should be getting those soon. Okay, one of the things that you're going to be receiving as the CFSS provider agency is a copy of the person's service delivery plan after they have completed it with a consultation services provider and it's been approved by the lead agency. So I just wanted to show you an example of what that looks like. So if you're not familiar with this form yet, you will be very soon. The service delivery plan, again, the person is writing the plan with assistance of their consultation services provider if they choose to receive that assistance. but the consultation services provider is reviewing the plan, sending it over to the lead agency for approval. And then once it's approved, the lead agency is responsible for sending you, the CFSS provider agency, a copy of the approved service delivery plan. So most of the plans that you're going to see right now are going to be new plans. It's going to have the person's identifying information here. If they have a representative, that information is going to be listed here. Some information about the individual, how many units they're eligible for in the service plan year. So I'm just going to do a quick example for you. We'll just put 10,000 units in as an example. Are they eligible for the enhanced rate? Let's just say no. Consultation services provider information is going to be listed here. Okay. Just some more information about the individual. And then the CFSS model. So remember, when they're meeting with a consultation services provider, consultation is educating the person on the different models that are available. So they'll educate them on the budget model and the agency model. And the consultation services provider is required to remain neutral. Their job is really just to provide that education and assist the person in understanding the difference between the two different models that are available. So the plans that you're going to be receiving as the provider agency is for somebody who's chosen the agency model. So you should see your information listed here. Some individuals may choose to have PERS, or personal emergency response system, as a part of their plan. So if the person does, there's going to be information about that PERS provider here. If the person plans to purchase any goods or services, that is going to be indicated here. And the purchase of goods and services needs to go through a financial management service provider or an FMS provider. So you, as the CFSS provider agency, are going to be managing and hiring and paying the employees for paying the workers under the personal care line. But if an individual chooses to use some of their units, convert those into dollars to purchase goods and services, that's going to be managed by the financial management service provider. Okay, so you might see FMS information on here if the person has chosen to access goods and services. Okay, and then there's just a general schedule for their employees. So they can either use the same hours each month, an estimated same hours each month. They're not required to. Or if they did not want to use the same hours each month, then they're going to select no. Information about the type of workers they would like, activities of daily living, IADLs. Okay, then we're just answering yes or no to some behavior, medication, health related questions. All budgets will automatically have a worker training and development section for $1,328.64 a year. This is for you as the CFSS provider agency to train the workers and do that evaluating the workers, etc., kind of like what the qualified professional had done in the past. Okay, so the supervising professional under CFSS. That is the $1,328 is where that is coming from. And if you do run out of those funds, you can request to have additional worker training and development funds added to the person's service agreement. Okay. Backup and emergency plans will be listed here. The individual abuse prevention plan. This is a section of the plan that will come to you blank, and you are responsible for completing this section of the plan with the person. Okay, so the consultation services provider is not completing the individual abuse prevention plan. Instead, that is done with the provider agency. So with you as the provider agency. Okay. And then at the bottom here, it's just signatures. We do require that the person sign the plan or their representative, consultation services, and the lead agency. Okay. We are aware that some individuals are having difficulty signing the plan directly, just based on Adobe, the Adobe document itself. Some people just don't have the right Adobe version to sign the plan. And so you may see some that are not signed. Hopefully the lead agency is having a different way that they're getting that signature from the individual person. But know that if the lead agency has signed the plan, it is approved. Okay. And then here is just going to be a summary of all of the various lines or items that the person will be using their CFSS units and dollars for. Okay, so I know I went through that kind of quickly. I'm just going to pause for a minute to let that sink in. Okay. So the next piece that is linked to the service delivery plan and important to talk through at the same time is an addendum, a lead agency addendum that's going to accompany the service delivery plan. Okay. So on the service delivery plan, the person and the consultation services provider is developing a plan based on certain dates that they believe CFSS is going to begin for the individual. However, the services actually do not begin until the lead agency approves the service delivery plan. Okay, so the person and the consultation services provider may be meeting and developing a plan for a couple weeks, or going back and forth of what they want to include in the plan. And so they may put on the plan that the services are going to start on January 1st. But maybe they don't actually complete the plan and submit to the lead agency until the middle of the month. And then the lead agency reviews and approves the plan on January 20th or something like that. The lead agency needs to adjust those dates and prorate the units that are available for the individual based on the approval date. We received feedback from lead agencies that they did not want to revise the actual service delivery plan because the person had already signed that plan and the plan was developed with the consultation services provider. So what they're going to be doing instead is using this lead agency addendum to the CFSS service delivery plan. So I'm going to open that up and show you all what it looks like. Okay. So this is the addendum. And of course, when it's coming to you, the person has chosen the agency model. Okay. So here is going to be the person's identifying information, and the lead agency is documenting what date the service authorization is going to start. Okay. So in the example I just said, the plan may say January 1st, but the lead agency didn't receive and approve the plan until January 20th. And so they're going to list January 20th here for the authorization start date. And then the authorization end date is whatever end date, 1 year after the assessment occurred. Okay, so let's just say in this example, it might be December 31st. Okay. Then what the lead agency is going to do is they are going to type in the service type, the total units, and then the MMIS code or the procedure code that you see on the service agreement. So for example, you might see personal care listed here. And then the total units might be, that'll be a prorated amount. So if you remember a couple minutes ago when I did the sample plan for you, I had listed 10,000 units. So let me go back up here. I'm going to show you what this might look like. If I put in dates here. Okay, and then we can do personal care. And 10,000 units was the amount that was available when the person started on January 1st. So those units may be prorated. So I'm just making them up right now, and I'm going to say that they're actually approved for 9,980 units or something. Okay, and then the procedure code of T1019 U9, I believe, is the modifier. Okay. Then if the person has goods or services, that's going to be listed here. So maybe $1,000 for goods. Okay, and then they're going to worker training and development is going to be listed here. And so they can continue to add each of the different services that are available for the person. Okay. And then afterward, the lead agency is going to fill in their identifying information along with a signature. So what you should be getting from the lead agency is a copy of the service delivery plan, as well as this addendum. And this addendum will really act as kind of like a cover sheet for you and for the individual person. So they can see exactly the services that were approved and the total number of units or dollars that are available for each of those different service lines. Okay. So if you receive a service agreement and the service agreement is either incorrect or changes need to be made throughout the year, we ask that you submit a technical change request. And we created a new technical change request specific for CFSS. So this is different than what you've been using for PCA services in the past. This document, it's the 6893K. It was just developed on January 21st, so just last week. It's brand new information. So if you're working with an individual currently who's using CFSS and you need to request a change to the service agreement, please go ahead and use this new 6893K. All right. And you're going to be using that to make changes to, say, the units if the person is adding goods throughout the year, or you need to request more worker training and development. Those are probably two really common examples that you're going to be using this for. So when you are submitting the 6893K or the CFSS technical change request form, please make sure that you're completing all of the fields that are required. So if you don't know the person's PMI number, please look that up. Be in contact with the person, ask the lead agency. Please don't just submit it with a list of zeros or a list of random numbers. We do need it to be the actual person's PMI number. Please provide us with a direct phone number if we do need to reach you, rather than a phone number to like a general voicemail or call tree. We just want to make sure that we're able to reach you directly if we do have questions. Try to be as clear and concise as possible if you are making a note on the technical change request. And then know that starting on February 1st, we won't be able to process any requests if the information is missing or it's incorrect. So just make sure that you are filling it out in full and that all of the information is correct before submission. Okay, so I know that that was kind of basic information and you probably have a lot of questions, which I'll review in a minute here with the chat. But one question that we wanted to ask you, since this is our first lead agency office hours, is what topics are you interested in learning more about at future office hours? So in a minute, we're going to put the poll question up on the screen and give you an opportunity to answer that question. But we wanted to start today's meeting out just real general, kind of give you a general overview of CFSS, and then future office hours, we want to be able to answer specific questions or train on specific topics that you really want to learn more about. So Anna, would you mind putting up that polling question and then we'll have everybody answer?
Right, the poll is active.
Awesome, thank you. And you should all be seeing that come up on your screen. If you don't see the question, look towards the bottom left of your screen. It's called Slido, S-L-I-D-O. It should be near the question and answer part of your screen. But the question, what topics are you interested in learning more about at future office hours? So the choices are enrollment, service delivery plan, goods and services, worker training and development, the role of the consultation services provider, PERS, the role of the FMS provider, or if there's any other topics that you'd like us to go over, you can go ahead and write that in the box. And then when you're done, just press send. So I'm just going to wait. I'm going to give you guys a minute or two to have some time to type in your answer. Okay, hopefully you all had enough time to answer. We have just a few more slides and then I'll go ahead and take a look at the chat and answer some questions that have come through. So these are some great resources that are available for you. The CFSS policy manual, which I showed you at the beginning, if you're not familiar with the manual, I really recommend taking a look at it, in particular, the provider agency pages. There's multiple pages related to provider agencies, so that will be important for you to know. We have these service agreement calculators. They probably aren't going to be as important for you as they are for lead agencies and consultation services providers, but it is a resource for people to use to determine the number of units that may be available for them if they decide to purchase goods and services or PERS and have other some of those units converted to dollars. It will help them understand how many units will be remaining. We have a frequently asked questions webpage, and so you are welcome to look at that frequently asked questions webpage. I'll just click on it here. So we have information for individuals that are receiving services. We have some for workers, and then we have some for agency providers and lead agencies. And so you'll see here, it looks like it's been updated as of October. These are questions that we've received from individuals, whether that be providers, lead agencies, or people themselves. And so we are working on updating this. We get a large volume of questions that come in every day, and it is quite a task to have our webpage updated. So we're working on doing that, but a lot of information is on this page. So just go ahead and you can sift through and find some more information about CFSS. And then if you are not signed up to receive our e-list announcements, we recommend that you do that because we are posting in January. We've published two e-list announcements regarding CFSS, and I looked in 2024 and we posted about 20. And so that is important. That is how we're getting information out to all the different provider types as well as people and lead agencies. Okay. We are going to be having these meetings every other Tuesday from 11 a.m. to 12 p.m. So you'll see that we have 2 scheduled in February and 2 scheduled in March. We will likely extend these into April, but for now we've just have them scheduled through March. So if you have not registered for the entire series, please go ahead and do that. Obviously, you registered for today's training since you're here, but if you have not yet registered for future office hours, please do so. Okay. And then going forward, if you have some questions that you have of us, this is the best way to reach us at this email, dhs.cfss@state.mn.us. Before you submit a question, we ask that you review the policy manual to see if your question is answered in the policy manual, and take a look at the previous e-list announcements and probably the FAQ page as well, just to see if we've already answered your question. That's probably a quicker way for you to find the information you're looking for. We do, like I said, we do get a large volume of questions, so sometimes it takes us a few days to respond to the emails, but know that those are being seen, and we have a team of people who are looking at those emails. When you email us, if we can just ask that you identify yourself as a CFSS provider, This email address, we're getting emails from FMS providers, lead agencies, individuals receiving services, consultation services, and CFSS provider agencies. So it's helpful to us if we know who is emailing us. So if you're emailing as a CFSS provider agency, just identify that in the start of your email so we can best answer your question. Okay. And then this is the last slide. But I'll go ahead and answer some of the questions that are in chat. And Janine, are you still on the call? I can see the chat today. I wasn't sure if you had answered some of these already.
I have not, no.
Okay. All right. So I'm just going to scroll up to the top and answer what I can. So yes, you all should be receiving, if you already have a 3-month service agreement for an individual, you should be receiving the 6-month service agreement soon. Like I said, we are working on those February service agreements right now. So if you have a service agreement that ends at the end of January or prior and you have not received that service agreement, I would recommend contacting the person because it's possible that they have chosen another provider. That might be the reason you haven't received that extension. Or maybe they've chosen to do the budget model and they're working with an FMS provider who has a service agreement for that individual. So first you want to verify if the person is going to continue with you as the CFSS provider agency. And if so, then go ahead and submit that technical change request, which was the 6893K. I'm going to pull that up again so you can see that. You'll want to submit the technical change request to request that service agreement. Otherwise, know that we're working on the February service agreements right now. So if you have a service agreement that ends at the end of February and you have not received that extension, you do not need to send. In fact, we don't want you to submit the 6893K for those. Those will be coming, okay? We only want you to submit that if you know someone's continuing with you and you don't have a service agreement for them if they've ended January 31st or prior. There's a question on how does the person write their own plan? They would just access the service delivery plan on their own, and then they can begin working on that plan. They don't have to write it on their own. They can write it with the assistance of the consultation services provider, but they have the option to write it on their own if they'd like to. Providers should be receiving the service delivery plan via email or fax. I suppose that is up to the lead agency, however they decide to give you a copy of the service delivery plan. You would probably have to ask the particular lead agency how they're going to get that to you. I see a question, who is a consultation services provider and is that the support planner? So the consultation services provider is an agency that every person has to use to when they are using CFSS. So the consultation services provider, we have 18 providers enrolled in the state of Minnesota. And every person receiving CFSS has to work with the consultation services provider. That provider can help them write their service delivery plan. Or they can just review the plan for the person. So they're responsible for educating the person about CFSS, answering questions throughout the year if the person has questions about CFSS, or perhaps the person wants to change between the agency model to the budget model, or the budget model to the agency model. Maybe the person wants to add additional goods and services to their plan, or they want to add PERS. Or the person just has questions on any questions regarding CFSS. Those are supposed to be directed to their consultation services provider. So consultation services doesn't have support planning. It's not a support planner. They have some similar functions, but CFSS does not have a support planner as part of the service. It's the consultation services provider that is doing that education and assisting the person in writing their plan. There isn't a specific turnaround time to receive the service delivery plan. It all just depends on how quickly the person develops their service delivery plan and how quickly the lead agency approves the service delivery plan. There may need to be some conversations back and forth between the lead agency, consultation, and the person with that development if items are being included that are not approvable. And so there isn't any specific timeline of when that's going to come to you. I'm sorry, I'm just reading some other questions. I want to try to get through as many as we can without duplicating them. There's a question of if the provider agency can get a list of consultation services providers to give to the participant. Yes, that's actually available online. So if you just Google consultation services providers in Minnesota, it'll direct you to our webpage that has, let me see if I can pull it up for you. And this is a copy of that page, CFSS consultation services providers. And so you could print this out and give this to the individual if you'd like. Someone asked a question as the CFSS provider. You do not need to do anything that the process that we reviewed at the very beginning of the presentation, this authorization process. There is nothing that you need to do regarding this process. We just wanted to show you what that looked like from start to finish of what the person's working on before it comes to you as their chosen CFSS provider agency.
So Erin, there's a question about the requirements for a CFSS provider agency to evaluate services. And if that person, the participant, was with your agency as PCA and they're choosing you for CFSS, you still have to follow all of the requirements. This is a new program. And so even though you know the person, you need to follow the CFSS provider requirements for supervision and training.
Thank you. And if you're not familiar with what those are, again, I'd recommend going to our policy manual and looking at these provider agency pages to learn what those responsibilities are as a CFSS provider. There's a question on if FMSs charge a fee. Yes, they do charge a fee for their service.
There's a question about diagnosis code and authorizations in EVV. So there is a diagnosis code that's on service agreements. You are not required to use that exact code. You can use a code that is more specific or more directly related to the reason the person has services. There isn't a check back in between systems. Yeah, so I'm not sure about getting the diagnosis code updated because it doesn't need to match stuff in claims or the assessment or any other information. You just need to use a valid code.
We have a couple questions that are asking if you're working with a person right now as their PCA provider and the person has chosen the agency model, the question is, do they still have to use a consultation services provider? Yes, they do. So you should not be starting services with them until you have a service delivery plan given to you from the lead agency that's been approved. So they do have to meet with consultation, develop that plan, and then it needs to come to you as the provider.
So the service delivery plan will come from you from the lead agency, because it'll be part of their Min Choices product, and so they will send that piece to you, and then you would get service agreements in your minutes mailbox like you do now. I don't know if you answered this one, but a question about changing all of our documents to reflect CFSS wording instead of PCA. So what we're doing here is that we're doing a lot of PCA plus CFSS or slash CFSS, and then we will be converting all of our documents to only say CFSS once everyone is rolled out of PCA.
So there's a question, who completes the 6893K? That's you as the provider agency. Lead agencies have a different form. It's 6893I is what it's called, but this one that has the K, that's specifically for agency, for providers. So you as agency provider, consultation, and FMS providers will use this form.
There's a question about homemaking and PCA or CFSS, and the state plan service of PCA or CFSS is what we're talking about. Homemaking is a different service, and so even though it's oftentimes put together, we're just talking about consultation for PCA and CFSS. It is not, homemaking isn't in our program area.
I've seen a couple questions regarding consultation service providers, and if they're being neutral or you feel like they are not being neutral when assisting the person as far as their education regarding I'm assuming you're referring to the budget model versus the agency model, or possibly different providers that might work with the individual. So I would recommend, if you feel like there is an issue, you can go ahead and submit. Janine, do you happen to have the form number off the top of your head? The form that they submit to, let me see if I can find it quick. I'm sorry, everybody.
Is it the content form, the DSD form, or
Yes,
which
thank
one?
you. Yes, the DSD form.
I will find it.
Okay. So we have a form that you can complete to send that in to us. While Janine is looking for that, there's a question of is the FMS role subject to the budget model or the agency model, or both? So an FMS provider is only doing the budget model. Okay, now there might be agencies who are both providing FMS services, and that same agency has another part of their business that's also a CFSS provider agency or a consultation service provider agency. But the budget model has to go through the FMS. Janine, do you want to go through some other questions? And then I saw a comment here asking for us to put links to the resources that we have throughout the PowerPoint into the chat. So I'll go ahead and do that if you have a second to maybe go through some of these other Q&As.
Sure.
Okay.
Did my answer go out? I put a link in the, I can't get my thing
I
to
don't
work.
see it.
Okay. Just give me a second, everybody. Sorry.
I see a question here of if the lead agency is the county. So that's a good question. I apologize for not making that clear at the beginning. So the lead agency is what we refer to when we're talking about the county, the managed care organization, or the tribal nation.
Oh.
Okay, and for some reason, Janine, I just tried to put the link in there too, and I don't think it worked for me either. And I wonder why we're not able to respond.
I think mine went directly to somebody because I can find it under my Q&A, which is not what I really meant.
Oh, someone wrote there. They are seeing the links. Okay, thank you,
Okay.
everybody. For some reason, we can't see it on our end. So thank you.
Yes, thank you. There's some questions about worker training and development. And so outside of the mandatory CFSS/PCA worker training, the certificate that is required for workers to be enrolled with us as a provider, the worker training and development budget, it's a lump sum budget, will be something that you discuss with the person, and you could use it to send a worker to a class, to pay for a class, or you can use it to bill your time as you're doing supervision and training of workers. And so when you work with the person with their service delivery plan, you will talk about anything unique that their workers need to know and how you will work together to train workers, supervise workers, etc. And so that we don't dictate beyond like that certificate. We don't say what they need to know. It's really put in the plan about what they need to know. There's a couple questions about MnChoice's assessments and things coming out of MnChoice's. We'll have to get back to you on that because I do think there were some reports that were happening, and I'm not sure if they're still happening, but I think it was the supplemental summary charts that would be coming out to you from MnChoice's. For the people who are getting a contracted PHN assessment, so our A assessment that Aaron talked about earlier, those will come out looking like that assessment that you're used to coming to you. It would just be the copy of the assessment, the legacy paper, in quotes, paper document.
Would someone mind confirming if you're seeing the links that I'm putting into the chat? I'm not sure why we can't see them on our end. Okay, thank you. All right, I'll keep going through the PowerPoint and grabbing the other links. Thank you.
Okay.
The links will show up right below the question that was entered, so it won't be in the same order because this is the Q&A, not a chat.
Oh,
Thank you.
good to
If you
remember.
want, I
Thank you.
can open a chat.
Anna, could you do that? That might be easier. That way all the links, I'm going to try to just put them in order, and then everyone can just grab them rather than having to maybe sift through. That would be really helpful. Thank you very much.
And remember, everybody, you can see the PowerPoints and the resources on the DSD training archives. If you Google DSD training archive, it'll be the top result.
Nice. Thank you. Thank you, Anna. So I think there's a question about CFSS, be a consultation provider at the same time. So we do have some companies that have a number of books of business. Some of them may be PCA agency, it may be FMS, it may be CFSS consultation, but we don't allow a conflict of interest. And so when we've talked a lot with consultation providers is when they're starting to work with a person, they need a written document to share with the person so the person understands their other books of business. So if I'm a consultation provider and I have an FMS and a PCA agency, I need to give that information to the person so they understand if they're choosing me for consultation, they can't choose the other agencies like our FMS or our PCA agency. They can't choose them. And so we're asking this has been a rule pretty much across the board in many of our services, but we're asking consultation to actually provide a written notice to people and discuss that with people so they understand that they can't use a different part of our company or affiliated part of our company for the other things if they're choosing to get consultation from me, for instance. As a provider, you cannot access the MinChoices summary through MinChoices. So the lead agency will be sending out the approved plan and the addendum, the W, to you, as well as any other assessment information that they're required to send. So you'll be getting it from the lead agency. You won't be able to get into MinChoices to look. Yeah. So there's a question about hospice, and the rule is basically the same as it was in PCA. There needs to be some communication with the hospice provider, and there needs to be something on the service agreement for the personal care services. It says a comment on the comment screen that says this is non-duplicative. We've coordinated with hospice and this is a non-duplicative service. So hopefully that answers your question. I think it's very, if you've been in the business, it's the same as we did for PCA.
I see a question. If an agency has not been coded for CFSS, but receives a pended service agreement, does that mean they can start CFSS for the person? So no. If you're not coded for CFSS, or if you have a pended service agreement for any reason, you are not allowed to provide that service for the individual. Well, I noticed we are just slightly over time. I did put copies of all of the links from the PowerPoint into the chat. So go ahead and copy those before we close out. And we'll plan to meet again in 2 weeks. We'll review the poll answers to see what information you wanted to learn more about, and we'll be able to create the presentation for our next meeting, I believe, which is on, I think it's February 7th. Let me go back and look here. It is on February 11th. So the following, so 2 weeks from now, February 11th, we'll meet again. And we'll probably do like we did today, where we'll go through a couple different topics and then allow some time for question and answers. So thank you everybody for attending today. We appreciate meeting with a new group, and hopefully you found this helpful, and we'll see you again on February 11th.
Thank you, everyone.